Hello, my name is Jessica Lascano, and I am a school psychologist with the San Bernardino County Superintendent of Schools. I am also a licensed educational psychologist and board certified behavioral analyst. In the past, I was a special education teacher, and I'm entering my 19th year in education. I am the parent of a son who has an IEP, and I have experienced psychoeducational assessment from both the perspective of school psychologists and parents. And today I want to talk to you a bit about psychoeducational assessments and answer some commonly asked questions. If you're new, this may be a topic that is stressful or overwhelming. And even if you're well versed in the IEP process, it may be something that you've never quite understood or something that you had more questions about. So today I hope to connect with you and answer some of those questions and help you feel better equipped to participate in the psychoeducational assessment process and to understand psychoeducational assessment. So what is a psychoeducational assessment? Well, it's an assessment that we do to determine whether or not a student has a disability. And this assessment is really looking at disability as defined under California Education Code and IDEA, which is the Individuals with Disability Education Act. And these two sets of laws govern what we do in special education and how we assess. So when someone asks for a psychoeducational assessment at school, or even when someone asks for an IEP for their child, this is the kind of assessment that's going to be done. This assessment helps us to determine student needs, and it also helps us to determine skills. Sometimes you'll see when we do these assessments that we're assessing an area where a child may be strong, or we might look at an area that you've never heard of. And the reason we're doing this is because we're trying to do a comprehensive assessment and make sure that we learn about your child's strengths as well as their weaknesses, and that we're looking in all possible suspected areas of disability. What's really important about us learning about your child's strengths is that we can use some of those strengths to help us to support their weaknesses. And so that's why you may see your child getting assessed in areas that you didn't think were an issue or that you didn't indicate were an issue when you asked for assessment. And sometimes during assessment, we as assessors, while we're working with kids, start to see things that perhaps were not identified earlier. And we may begin to look in other areas based on what we see during assessment. So let me give you an example. There's been times in the past where a child is referred because the parent or the school believes they have an emotional issue. And so I'm looking in assessment for something called an emotional disturbance, which is a disability that's defined. And while I'm looking for this emotional disturbance, I start to see that some of the things that this child does that may be related to autism are being classified as emotional struggles. And so my assessment may change a bit and I may start looking for autism because that's a new area of concern. So just be mindful that we may go in with one assessment question or two or three, and those questions may change or evolve during the assessment process because we start to find out more about the child during our interactions. A psychoeducational assessment is also going to help to provide foundational information, which we're going to use to build an IEP. If the child qualifies, they'll be eligible for an IEP if the team agrees to it. And we will use the psychoeducational assessments to create this IEP. It'll help us to determine where we should make goals. It'll help us to know what the student's present levels are. It will also help us to understand what sorts of accommodations or modifications a student might need. So the psychoeducational assessment and report are very foundational for us as we begin to build IEPs. These are the special education areas of disability that I talked about on the last slide. And these areas are defined in California Education Code. And if you'd like to read that for yourself, you can go to this link here. They're also defined in IDEIA, which is known as IDEA 2004, which you can find at this link here. And if you go to these links, you'll see that each of these areas is identified with a specific set of criteria and also information that will tell you when a disability is present. So one thing I recommend to parents and families and guardians and anyone out there who's interested is to learn about these areas, read up on what constitutes a disability in each of these areas, and learn about the criteria for them because they're very different from one another. And we as assessors are going to be looking at disability in one of these areas. So when we go in to do our assessment, it's going to be because we're looking for a potential disability in these areas. And it may be more than one. Sometimes we go in to do an assessment and we end up looking at a couple of different areas. And so this is something that you should be aware of, and you should read the law and learn more about what exactly constitutes a disability in each area. And I want to say that, something you should know is that it's a little bit different than what's defined in medical code or in something called the DSM. So if your child has a diagnosed condition for mental health, that practitioner who diagnosed them likely used something called the DSM, which is a manual that lays out the various types of conditions that may exist in mental health. And the criteria within those conditions is a bit different than the ed code. So I want to also point that out, that sometimes a child who qualifies privately through a doctor or a therapist or a psychiatrist may come to school and be assessed and may not meet eligibility criteria because we have different sorts of criteria in the schools versus mental health practitioners and what they use. So I just want you to be aware of that as well. And if you read these laws, you'll learn more about some of those differences, specifically if you're familiar with the DSM and how different practitioners use that to offer clinical diagnoses, and they're different than our educational disabilities.